Our next witness is Mr. Robert Weissman, who is president of Public Citizen. Mr. Weissman is an expert on drug pricing and specifically ensuring equitable access to drugs. Mr. Weissman, thanks a lot for being with us.
Thank you very much, Chair Sanders and Ranking Member Cassidy, for the opportunity to be here today. I think it's fair to say that Operation Warp Speed was a great success in speeding the development of COVID vaccines and a validation of the BARDA investment model to an extent. But it was also a great failure, and we need to learn that lesson as well. It was a failure in that, although the U.S. government was responsible for funding of the COVID vaccine from before COVID even emerged, through the isolation of the key spike protein, through the clinical trials, and up through the development and production of the vaccine, BARDA imposed effectively no restraint on how Moderna and other partners, but especially Moderna, would operate. The result was, while Moderna executives became billionaires, taxpayers were price gouged. Hundreds of thousands or maybe millions of people lost their lives because we had a global shortage of a vaccine that could have been avoided if we had shared the technology. And now Moderna has announced it plans to quadruple prices, further limiting access, further gouging consumers, further gouging the taxpayer. As everyone here has agreed, we need to learn the lessons from what happened during the pandemic period and do better going forward. We absolutely need PAPA, we need BARDA, but we need to do better. What are some key lessons going forward? First, we need more transparency in the contracting process. Taxpayers should know who they're providing grants to, who are they making acquisitions from, and on what terms. When drug companies and vaccine makers are making co-investments in a product, they should know, taxpayers should know how much is being done on the private sector side along with the public side. Second, we need to have reasonable pricing for the products that we, the taxpayers, pay for. That should just be common sense. If we pay for it, we ought not to pay for it again with unreasonable prices. The starting point for reasonable pricing should be that the United States does not pay more than other high-income countries do for a product, but that's just a starting point. We can do much better than that. In general, the way we should think about reasonable pricing is tailoring a reasonable price to the amount of private sector investment and risk taken. Where the government pays for the development of a drug all the way through, the reasonable price should be a lot lower than where a private sector partner took on a lot of the risk and made a lot of early stage investments. Third, we have to guarantee international access. We know that pandemics definitionally mean that everyone around the world needs the products we're talking about. Drug manufacturers, vaccine makers may not have capacity and often don't have interest in serving the global markets. As such, we should have a proactive requirement for licensing to the World Health Organization of crucial technologies and licensing and sharing of technology and know-how as well to make sure that other manufacturers can produce products that everyone needs. Last, we should consider, as well as the traditional model for supporting research and development, prize models, such as those that you've supported in the past with legislation, Chair Sanders. We know in the case of BARDA that the patent monopoly model of support innovation by definition doesn't work. That's why BARDA is making the investments, because the private sector model in these cases, as Commissioner Califf has said earlier, doesn't work. It's at least insufficient. Given that, we ought to think creatively about what might work better. Prizes can be calibrated to provide appropriate incentives sufficient to enable manufacturers and researchers to enter the space, while also ensuring affordability and access on the back end. Can also do other things to promote innovation, like giving people rewards when they don't actually get the final product, but they make contributions along the way. So these are some of the lessons I think that come out of the pandemic and that we must incorporate into PAPA going forward. Thank you very much.